show you a little bit, if you haven't been joining us previously, on how to use the HopIn Navigation. So if you look over here on the left, you will see this big red one. And in this big red one, in this red box, there are some little icons. The top one is just HopIn's logo. You don't need to worry about that. The next one is a little house. And in that one, that is where everybody who signs up for HopIn ends up in this little house. That is known as the reception area. The next one is this little camera, and that is the stage area. And the last one is the expo. So we'll go over here to the right, and you see this big red 2. And again, in this red box, you see something that says chat and polls and people. If you wish to ask us a question or you want to make a comment, you can go down here into the red box in the 3, and you can type something in. That will put your comments in the reception area. If you are willing, we would encourage you also to help take the polls, because that gives us information that we can use for funding agencies to continue this program. As you can see now here, we have gone to the stage. You can see here that the little red or blue camera has come on. And again, over here on the right, we have the big 2. So now if you want to send a message to me while I am talking on the stage, you can type down here in the 3 box, and then we will get those questions. Now we will go to the expo, and as you can see, the blue light or the blue in this little tent looking thing has come on. Again, over here, we can see that we have these various exhibitors. So today we have with us Kaiser Permanente, and they are one of our sponsors. In addition to that, we have Integrity Insurance, and in addition to that, we have Humana. We also have with us today our partners from the Centers for Medicare and Medicaid Services. And after we finish this presentation, I will be at the Colorado Gerontological Society's booth. What you can see here is that this is the outside of the booth. When you click on it, what happens is it goes to this screen. And you can again see over here on the right or on the left that the blue light is now on the little tent looking thing. If you look over here on the right in the 2, you'll see that these words have changed, and we now have the word booth. So if you wish to talk to me while you are in the booth, then you can hit chat, and that will give you then the opportunity to type in here. And again, you can take a poll. And I will be able to see what you type in the chat, as will our other exhibitors. In addition to that, there's a little bit of information about each one of the exhibitors. And if you click on the number 4 box, then you can get more information about whatever it is that they are offering today. If you want to see me in the exhibit booth, you click here on the number 3, and it will share audio and video, as will the other exhibitors. And you'll be able to talk with them as well. So with that, let's go ahead and get started on these Wednesday Lunch and Learns. Today's topic then is specifically on Medicare while you are still employed. The first thing though that we want to do is we want to look at the difference between parts and plans. Medicare has parts, and they have 4 parts: A, B, C, and D. Medicare Advantage, Medicare Supplements, and prescription drugs have plans, okay? And these supplement or support the parts of Medicare. So again, just to review, Part A then is hospital insurance. This includes basic things like being in the hospital after you pay the deductible. It includes skilled rehab after you've had 3 midnights in the hospital. It includes skilled home health after you have had 3 midnights in the hospital. And it includes hospice care. Medicare Part B is what they call medical insurance. This includes things like doctor's visits, labs, x-rays, emergency rooms, durable medical equipment, ambulances, preventive services such as immunizations. All of those things come under Medicare Part B. Medicare Part C then is a Medicare Advantage plan. This is optional. And if you choose to enroll in a Medicare Advantage plan, basically they offer Part A and Part B services, as well as often some additional services over and above what Medicare Part A and B offer. They also every year negotiate with Medicare what their network is going to look like. They also negotiate every year what their benefits will look like and what your out-of-pocket expenses will be if you sign up for a Medicare Advantage plan. It is not necessary to sign up for one, but you can if you want to. And then the fourth part of Medicare is prescription drugs. And this is basically where you enroll in a private prescription drug plan. They, again, have certain federal rules that they have to follow in terms of the prescriptions that are drugs that are on the formulary, how often they can change, who their providers are, etc. So that is regulated, again, by the federal government. There is a premium for Part B, and there is a premium for the prescription drug plans. The Part C plans sometimes have a 0 premium. Many of them this year do, some in Colorado, and some do have a premium. Usually Part A is free, and there's no premium. So basically that's what this screen shows you, is what the premiums are for the different parts. So our topic today, now that we have a little bit of basic information, is to look at what happens in terms of your company if you are still employed. So the biggest criteria is, are you in a company that has 20 or more full-time employees, or are you in a company that has less than 20 full-time employees? The very first thing that I want you to know about in this is credible coverage. This is the most important thing related to employer coverage. So what credible coverage means is that the health insurance that you have through your company is the same or better than the benefits that are offered by Medicare. So if you are still employed and you are looking to keep your employer plan, the very first thing to do is visit the HR department and make sure that your coverage is as good or better than what Medicare offers. After that, then in terms of after you've made that determination, then the next thing you want to basically look at is whether or not you should stay with your company plan, and that is based on the size of your company. So let's take a look. If you are in a company that has more than 20 full-time employees, and either you or your spouse are working, and you have employer health insurance, then after we check out whether or not we have credible coverage for both health coverage as well as prescriptions, then the next thing we need to look at is whether or not the company is going to pay primary and whether Medicare will or will not pay secondary. So when talking to the HR department, most companies with 20 or more employees are required to cover you with them paying primary on their health insurance. Then they can either opt to have Medicare pay secondary, or they can also basically continue to pay all of the costs as they would have previously. When you figure out whether the company, what their payment structure is, then that will help to determine whether or not you are going to delay enrollment in Part A. Part A, as we said, was hospital coverage. So if your company is paying primary, they may or may not want you to continue to enroll in Part A. You most likely then will want to delay enrollment in B and D if the company is going to pay primary and if Medicare is not going to pay secondary. If Medicare is going to pay secondary, then you're going to have to enroll in B and D. If the company is just going to continue to cover you as they have previously and there's very limited out of pocket, then you can delay enrollment in B and D. At this point in time, there's no real need to enroll in Part C. If you're in a company that has less than 20 employees, you may or may not have credible coverage. Again, check with your HR department. Usually, there's no coverage by the employer in companies that have less than 20 employees. They are not mandated by the federal government to provide coverage. Medicare then pays primary, and you do need to enroll in at least A, B, and D, and you most likely will need to then or want to either enroll in a Medicare supplement to pay secondary or the cost that Medicare doesn't pay, or you will want to enroll in a Medicare Advantage plan that will basically be your primary health insurance, and then your company health plan may or may not pay secondary. If you are in a company with 20 employees and you have decided that you have to enroll in Part A, B, and D, then we invite you to watch our video at the Colorado Gerontological Society's YouTube site on New to Medicare and follow those instructions. So this is basically the next series we're going to talk about a little bit is how to enroll in Medicare. And the thing that I want you to know is that there are 3 types of enrollment periods that you have to be aware of. There's actually a 4th one, which is called the annual enrollment period, but that happens every year if you want to change Part C and Part D plans. The initial enrollment period, the special enrollment period, and the general enrollment period are significant in terms of how you get Medicare benefits. So if you are age 65 and you're in the initial enrollment period and you're already receiving Social Security, then you're automatically going to get Part A. If you don't receive Social Security, then you need to go to mysocialsecurity.gov and open up an account. You can do that online. You can call the 1-800 number for Social Security, which is 1-800-772-1213, and make an appointment or visit a local office. However, many of them are closed temporarily due to the pandemic. Once you sign up for Social Security, then basically you have to sign up to avoid penalties. Even if your company offers coverage, you do have to go through this process. And then once you are signing up for Medicare at medicare.gov, or I mean at socialsecurity.gov, then you will want to either enroll or delay enrollment depending on your coverage by your employer, and it is free. So that's what happens at age 65. If you're receiving Social Security, you automatically get it. If you're not, go in, open an account, and then based on the size of your company and what kind of coverage they're offering will depend on whether or not which box you check during the enrollment on the online application. And Part A is usually free. If you delay enrollment for some reason or other, then, and you do this all correctly, then you will create for yourself a special enrollment period. You can decide to enroll in Part A anytime that you're eligible for this premium-free coverage. It will be retroactive for 6 months. So say I turn 65 in January, I decide not to enroll in Part A because I have employer coverage. And now I am in August of the same year that I am 65, and for some reason or other, I want to enroll in Part A. I can just do that at any time. And then my Part A will become effective March 1. If you decide to work until you're 70 and you continue to have this delay, and once you fill it out, you don't have to do it anymore, and now you're age 70, then basically you enroll in Part A after you lose or leave your company insurance. If you do delay Part A, you have 8 months to enroll after your coverage ends. So just make sure that you know that number and that you do it within the time frame. If you miss for some reason or other this 8-month enrollment period and you don't do the special enrollment period correctly, then you have to do the general enrollment. Or if you do not delay over here on the initial enrollment correctly and get the special enrollment, then you're over here in the general enrollment. The general enrollment basically is between January 1 and March 31, and coverage begins July 1. And the cost may vary. Usually it's free, but now you will have triggered a penalty. Medicare Part B is very similar to Part A. So if you're already receiving Social Security, you'll automatically get Part B. If you're not, you do the same process by going to the mysocialsecurity.gov account that you created and sign up for Medicare. And then based on what your company is offering, you decide whether to enroll or delay the enrollment. In 2021, there is a premium for Medicare Part B, and that is $148.50 per month if your adjusted gross income is less than $88,000 for a single person or $176,000 for a couple. If your adjusted gross income is over that, then you will pay the base premium plus an additional surcharge. Again, if you delay the enrollment by checking the box for Medicare Part B, then you get into the special enrollment and you have 8 months from the day when your employer health insurance coverage ends to be able to enroll in Part B. To do that, then you will use the CMS-L564 form. You will have to get your employer to sign that to prove that you had credible coverage, that your coverage was as good or better than what you had with Medicare after it ends. And then they forward that form to Social Security. If you do not sign up within this 8 months, then you can qualify for the general enrollment. And again, that's between January 1 and March 31, with coverage beginning July 1, and penalties will apply. Similarly, if you do not delay this enrollment over here on the initial enrollment and you do not do the special enrollment correctly, then you end up in the general enrollment period. And if you're in the general enrollment period, the penalties can be pretty significant. As I said earlier, Part C was optional. So let's look at what happens then in Part D. So again, we have our 3 enrollment periods, the initial, the special, and the general. and these work for Part D a little bit differently. So at age 65, once you enroll in A or B, you then can either enroll or delay your enrollment depending on your employer coverage. Again, it needs to be credible coverage. So it has to be as good or better than the minimum benefits that are required by Medicare. The cost then is going to vary by the Part D plan in which you enroll. Those costs vary from year to year. A lot of people will change their Part D plan during the annual enrollment period. So that again is something just to make sure you understand. If you delay your enrollment at age 65 in Part D because your employer has credible coverage, then you will be eligible for a special enrollment period. Now, this one is different. You can enroll in a Part D then within 63 days after your employer coverage ends to avoid this penalty. So this time frame for Part D is significantly less. It's a little over 2 months rather than the 8 months that you have for A and B. The employer again has to sign the CMS L564 to prove that you have credible coverage. The general enrollment period works just exactly the same as it did for A and B. So if you delay your enrollment in D, you do not exercise your special enrollment period in D within 63 days after your employer coverage ends, then you will be in the general enrollment period, which is again January 1 to March 31, and your coverage starts July 1, and you will face penalties. So the question really becomes, why would you want to delay enrollment? Well, the easy one is that your employer health plan will be the primary payer. They're going to offer that to you as an employee benefit, and you should take advantage of it because it is a benefit that your company offers, and it's something that you're entitled to. Medicare may or may not be the secondary payer if you're in this, if your employer's primary, and it will depend on what they basically pay in terms of co-pays, co-insurance, and other out-of-pocket expenses. Another reason why you may want to delay Medicare is if your employer health plan pays less than what Medicare would have paid if they were paying primary. So basically the way this works is if you go to the doctor and Medicare is going to pay $100 for your office visit and your company plan pays $120 for that visit, Medicare is not going to pay up here as the secondary payer. Basically your employer is going to, or the doctor is going to have to accept what the employer plan pays, which is the $120, and Medicare will not incur any expenses. So that happens very often, and sometimes that is the major reason why people in employer plans do not sign up for Medicare, even if they're in a group of 60 or 20 employees or more. The other thing that's important in terms of delaying enrollment is possibly if you have a health savings account. You may also want to delay enrollment in A and B. So how do you delay enrollment in Medicare? Well, before we look at that, let's look at a Medicare card. And obviously, probably many of you have seen these, but it has your name. Then it has a very scrambled number here as your Medicare number. But down here, these are the two things that we are most concerned about. So your hospital coverage, which is Part A, says that it starts in this instance on March 1 of 2016. Your medical, or Part B, also starts the same day. Now, you will automatically get this Medicare card if you are enrolled or receiving Social Security. If you are not receiving Social Security, then you will have to use the process we discussed earlier. Go to Social Security's website and sign up for a My Social Security account, and then they will send you this. If you turn 65 and you want to delay this, then you do one of two things. You flip this card over and you indicate whether you want to delay both A and B and you sign it, or if you just want to delay one or the other. If you delay and send this card back, that will automatically also delay your D. Now, some of you may decide that you want to keep your A and only delay your B. And if that's the case, then you will get a new Medicare card that will take the Part B and the Medicare off, and they will issue then a new card with only Part A. And then when you submit that form that says that you are no longer enrolled in employer coverage, then Social Security will issue a new card, and you will have one date when your Part A started and a second when your Part B started. And it's important to know those numbers and those dates, because if you go to sign up for a Medicare supplement or a Medicare Part D plan, you will need that information. So when do you enroll after your employer health insurance ends? So this is just a quick review. So you enroll in A and B within 8 months after your employer coverage ends. And if you, to use your special enrollment period, and for C and D, you have to enroll within 63 days to use your special enrollment period. So make sure that you understand those deadlines. Again, Part C is when your employer coverage ends, then you may decide that you would like to also enroll in a Part C, and there shouldn't be any problems associated with it as long as you're using your special enrollment period. So let's take a few minutes and let's look at what are the penalties for Part A. So these penalties, if you sign up in the initial enrollment period when you're age 65, there's no penalty. If you miss signing up for your special enrollment period because you have delayed Part A and you didn't sign up within 8 months, or your company didn't have credible coverage. And just a little hint here, make sure, because companies are always changing their insurance plans, that just because when you originally signed up for Medicare and your company said they had credible coverage, and then they change insurance companies and the employer side the next year or 2 or 3, make sure that the new plan is also has credible coverage. If for some reason you mess up and you lose this special enrollment period, basically then the penalty is 10% per year for 4 years that you did not enroll and that you were eligible if you enroll, or you have to buy into it. Again, if you miss this 60-day or this 8-month window, you flip over here into the general enrollment period, and the penalty then is the 10% for every year you did not enroll, and you pay that for up to 4 years. So the penalty for Part B looks a little bit different. Again, there's an initial enrollment period, and you sign up at age 65, no problems. If you delay it and you create for yourself a special enrollment period so that you can sign up for Part B when you lose or your spouse loses their health insurance coverage, and you sign up within 8 months and you had credible coverage, no problem. If you do not sign up in this, then you create a penalty. And this penalty in Part B is very different. It's 10% per year for every year you do not enroll in Part B, and it continues for your lifetime. So if you mess up this 8-month window, or you don't do the delay properly during the initial enrollment, and you flip back over here to the general enrollment, then that is the penalty of 10% per year after you're able to enroll on between January 1 and March 31, and then coverage starts July 1. And it's important to know that that penalty, even when you enroll in January, that penalty continues to run until July 1. So an example is that if you were 65, you decided at age 70 that you wanted to enroll in Medicare Part B, you didn't do it correctly, or you lost your special enrollment period because you didn't do it within 8 months, then you would now have a 60% penalty that you would have to pay on your Part B premium for life. And this year, that 60% is figured on the $148. So you would have to pay about $80 or $90 per month extra for your Part B. The Part D is also a little bit different than the A and the B. So again, if you take your Part D at your initial enrollment period, there's no penalty. If you return the form and you do, or return the card, or you check the right box on your, when you enroll at mysocialsecurity.gov, then you won't have any issues because that'll create the special enrollment period. And then you just either enroll when you lose coverage, or you enroll during open enrollment between October 15th and December 7th. If you don't do the special enrollment period correctly and sign up within 63 days, then you will have 1% per month that you are eligible and you didn't have credible coverage, and this too continues for life. So again, you won't be eligible until you can, if you mess up the special enrollment and you didn't take it on the initial enrollment, or you messed up the initial enrollment and you didn't get yourself approved for a special enrollment period, and now you're in the general enrollment period, then basically that continues from January 1 through March 31. You sign up, and then you have coverage starting July 1. And you can change plans every year. This penalty continues for life, and that is 1% per month. So again, if, let me finish this and then I'll tell you I misspoke. So this is 1% per month for every month that you were eligible and you didn't have coverage. So if you sign up at age 70, on Part D, you'll have, and you didn't do it correctly, you will have a 60% penalty on Part D. And I said earlier that on Part B, you would have a 60% penalty, but you will actually have a 50% penalty if you sign up at age 70, because it's 5 years and it's 10% per year. I just did the math wrong in my head. Sorry about that. So, other things that I really want you to know about in terms of credible coverage is that once you're in this employer plan and you have made your decision, hopefully you will either enroll using the new to Medicare because you're in a plan that has less than 20 people. If you're in a plan that's more than 20 people and you have credible coverage, that you will enroll in your initial period. You will then delay, get yourself a special enrollment period, and everything will be good, and you won't have to worry about the general enrollment period. Some other things to know about, oftentimes when you leave your employer, they will offer you Cobra. Cobra is a health insurance plan. Sometimes the company pays that, and sometimes you have to pay the premiums. The biggest thing to know is that Cobra is not credible coverage. So if you are in an employer plan You leave your employer, they say, we will pay your health insurance through Cobra. Say, no, 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 no. We do not want that, because now you have lost your credible coverage and you will now be facing penalties. So do not take Cobra at age 65 or any time that you lose employer coverage, because it will basically trigger then you going to a general enrollment period, because you'll lose both your initial and your special. So just go to straight Medicare and enroll in the new to Medicare that is described on our YouTube channel. Another thing that some people get confused about is if you are in the marketplace or in Obamacare. So Obamacare, while it is credible coverage, the problem is that it is illegal to be enrolled in a marketplace plan when you are age 65 and eligible for Medicare. So again, if you're in the marketplace, you're in an individual plan, you're not in an employer group, or you know people who are in Obamacare turning 65, advise them to watch our YouTube video on new to Medicare and basically drop the marketplace plan so that it is, so you lose that coverage the last day of the month before you turn 65. So if I turn 65 on February the 10th, I then want my marketplace plan to end on January 31st, and I want my Medicare to start on February 1st. Other reasons why some people sometimes get confused is if they have VA or TRICARE. And again, we advise you to watch our YouTube videos on Medicare and VA or TRICARE. Briefly, VA has credible coverage, and you may or may not want to enroll in an A, a B, and a D. But VA often encourages you to do that. On TRICARE, basically TRICARE uses Medicare as the primary payer, and then TRICARE is the secondary payer. The other thing I want to call to your attention is that if you have an HSA or a health savings account, when you become eligible for Medicare Part A, and if you take it, whatever point in time that you enroll, age 65 or age 70 or whatever, you must not contribute to your HSA once you are taking Medicare Part A, because that will also trigger a series of penalties. Now, if you take your Part A, you stop contributing to your HSA at that point in time. You can use the funds that you have in your HSA to pay for qualified medical expenses for either A, B, or D. With that, we are concluding this presentation related to employer health plans. We have some resources for you. So if you would like to request a goodie bag, you can send us an email to cogs@senioranswers.org. Put your name, address, and telephone number in, and we'll mail you a goodie bag. If you have requested one previously, those are in the mail, and they are the same as what you would be getting currently. We also have a toolkit, which you might find helpful with some individual counseling. And you can call our office with questions about coverage. You can call if you're looking to change your Medicare Advantage or drug plans. If you're new to Medicare, you can call us if your plans are leaving this company, your Part C or Part D plans. If you need help paying for those premiums, or if you are confused about how to use the plan finder at medicare.gov. Other things in the toolkit is that there's a vast amount of information at medicare.gov or visit the Medicare booth that we have available for you here today during the presentation. The plan finder is what you use to figure out your prescription drugs and to compare the different plans and how much they cost. Remember that you need to sign up prior to December 7th to be able to take advantage of the annual enrollment if you are changing plans. We also have available the Medicare Drug Insurance and You newspaper that many of you pick up when you visit with us in person. And that is part of the toolkit. You can also view that at colorado.gov at this website and get that information there. Other things that we have in our toolkit is that we have our sponsors today with us, or you can visit their websites, which is Humana, Integrity, Kaiser, and Cigna. If you want more information on a complete list of the Medicare supplements, the Medicare Advantage plans, or the prescription drug plans that are offering coverage in Colorado in 2021, you can go to medicare.gov and you can get that information. So at this point in time, I would invite you to visit us at the expo. Our representatives from the different companies will be in the expo hall or the expo area, and I will join you there shortly at the Colorado Gerontological Society. Give me a few minutes to do that. To visit the representatives in the expo, remember to click on the tent on the left-hand bar that we went through at the beginning, and that will then take you to the expo. Click on the logo on the outside, and then you will be in that area. And with this, that concludes our presentation today. Thank you for your attention. If you have any questions, feel free to call us at 303-333-3482, or you can email us at cogs@senioranswers.org. We do have counselors standing by who can answer your questions. Thank you for your attention, and we look forward to serving you in the future.